This is One-on-One. Kathy McKean is a registered nurse, but she's also a senior manager, patient care services, Riverview Medical Center, the Children's Art Therapy Program. Good to see you.
Thank you. Good to be here.
We have worked together before. I've done some executive coaching down there, and one of the things I'm so excited about, we're actually going to show a clip from a piece called Tyler's Reef, which actually won an Emmy for its work in connection with art therapy and dealing with the grief of children who have either lost a loved one or are dealing with the chronic illness of a loved one, right?
Correct.
Talk about that. Children face some real tough stuff.
Yeah, it is very tough stuff, especially for children, and that's why the program was started. The program started 33 years ago at Riverview Medical Center.
Why?
A nurse was caring for a woman who was dying of cancer, and this woman had 2 small children. And she reached out to the nurse and she said, I need your help. I need you to provide some support for my children so they can grieve when I'm gone. And the nurse promised her she would. And that was the birth of the Children's Art Therapy Program at Riverview Medical Center in 1980.
Yeah, why is it so interesting? Because I know your operation well, part of the Meridian system, and our mutual friend down there, Tim Hogan, and John Lloyd, who heads the whole system. We've talked about this a lot. Why is it that nurses are the ones who very often are right there for the children? Why?
Well, nurses have that unusual relationship with the patient because they're 24 hours a day, 7 days a week, 365 days a year. All the other disciplines come and go and have shorter interactions, but nurses are there and they can't leave. They have full responsibility for that patient. And in caring for dying patients, sometimes you get unusual requests, at end of life. This woman was dying, it was end of life, and they depend on you to be more than just their caregiver. Now you're their confidant, you're someone that they're, expressing their last wishes to, and you're there. No one else is. In the middle of the night when they're lonely and they're fearful, it's the nurse who's at the bedside. It's an unusual...
Special people.
Yeah, it is. And it puts you in a very unusual position, but it also gives you an opportunity to do things that you might not have the chance to do otherwise.
In art therapy, it's interesting. I always wonder, how is it that art and children expressing themselves or their grief through art, how does it help?
Well, art therapy is nonverbal, and children have a hard time using words to describe their emotions. Sometimes they don't have the vocabulary if they're young enough. They're not comfortable enough with words. Sometimes their emotions are too painful, and they can't find the right words to describe what the emotions are. Sometimes they don't even understand their feelings well enough to know what words to use. So, but they can take emotion and feelings and put it on paper or make a sculpture of it or put it in a book. And then when that's in front of them, they can look at it and reflect on it. And it's outside of them suddenly, so it's a little more comfortable to deal with. They can share it.
How old are we talking about here?
Well, the Children's Art Therapy Program is for children aged 4.5 to 13 years old. And that's the way the program's been since its inception in 1980. In general, that's the age group where children have trouble in social situations or speaking with a counselor and talking through their grief or even speaking to their own friends and family. So art really does fit that void for them and brings it out of themselves and onto a medium that they can relate to.
And what's interesting about Tyler's Reef is this is a story about, this helps teens though, does it not?
It does help teens.
Set it up real quick.
And really, we had no teen group until we got the funding from Provident Bank to run this short animated film, which we partnered with Small Factory Productions on. We had 5 teenagers who had suffered the loss of a family member. First time we ever used teens.
Right.
We did it over the summer. So the teens had some free time, 3 hours a day for 5 weeks. And teenagers are different in that they don't like a lot of attention on themselves. They don't really want to talk about themselves. So we set it up for them in that, okay, we want you to create a film to help other teens learn how to deal with grief and loss.
And that's Tyler's Reef.
And that's how they worked through their own grief and loss, not even knowing it. They dove right in, they created the short animated production, they created the characters, they narrated it, they drew it. And at the end of that 5-week session, believe it or not, they had worked through their own grief, told their own story, really with the intent of helping other teens. So it's a great dynamic.
That's why we're going to take a quick look at Tyler's Reef. It won an Emmy. Take a look.
I have bad news. Hey, Bozo, wait. Where's Tyler?
That's what I have to talk to you about, Angelica. He was caught by a hook. He's gone.
Stop joking around, Bozo. We know you're a clown.
That's not something to joke about, Bozo.
I'm not joking, Sally. I'm serious. He's not coming back.
I don't get it. What do you mean he's gone? Where did he go? Why wouldn't he come back? We are inseparable.
Did he die, Bozo?
Yeah, the hook took him. I'm so sorry, Angelica.
If only I was with him.
You know, I was there for the screening of this, and I had to watch people's reaction. You've got to get to kids in the way they can relate to it, or in a way they can relate to it. And they related to this.
Yeah, they do. You know, it's very open, it's very honest, and it tells the story in just an honest, simple way.
Right.
Which was real great dynamic for the kids. I mean, in particular teenagers who kind of like it straight and honest and open. It was a beautiful story. They did a great job, and it won an Emmy Award, as you know, and you came and hosted our event for us.
It was great. By the way, show some pictures as we talked to Kathy in the last minute. Show some of the other artwork because it's really special.
Yeah.
We're looking at some artwork that children have made throughout this program. It is the Children's Art Therapy Program down at the Riverview Medical Center. Let me ask you in a few seconds we have left, what has this done for you?
Well, as a clinician, you know, I've never had much of a creative side, and I never really felt I was much of an artist. But I do appreciate the whole patient, and I knew there were needs that a clinician cannot meet. There's the emotional needs, the psychosocial needs, and that's why we reach out to social workers and our therapists to provide that care for the whole patient. And for me, it really was satisfying because I know that my skills only take the patient so far. And I know that social workers and our therapists bring their expertise in, and all of a sudden, you're bringing the family in, you're surrounding the person with everything they need to be able to go from a bad, tragic situation to really living a good quality of life.
It is a great program, Kathy McKean, Senior Manager, Patient Care Services, Riverview Medical Center, Children's Art Therapy Program. Thank you, Kathy.
Thank you.
We need more programs like that to help children deal with very difficult and painful circumstances. This is One-on-One. We'll be right back right after this. Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Sun National Bank, Qualcare Inc., New Jersey Manufacturers Insurance Group, ESC&G, Fedway Associates Inc., the Russell Berry Foundation, and by Cone Resnick. Promotional support provided by the Star Ledger and NJ.com, and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.